So good evening for everybody. It's a great pleasure to have this Professor Judy McDonald from the Ottawa University. Judy, it's a great pleasure for us have your lecture tonight. So Judy's Professor Judy, she works over than 25 years with this specific topic and studying performance. She started at the beginning with the Olympic athletes, and then she works in different high-risk professionals. So it's a great pleasure, Marcelo, to have to talk something.
I just want to thank all the participants and everybody in the meeting. It's quite hard to gather quite some people, especially late in the evening. I think that the Brazilian Society and Ricardo is pretty much the one to be thankful for, to start this tradition of having great video conferences sponsored by the Brazilian Society. And we couldn't be more happy and thrilled to have Dr. Judy McDonald here with us. She's very experienced in the topic. It's something that I don't think that most pediatric neurosurgeons are familiar with. I think they should be, but they're probably not as much as they should. So we're really happy and fortunate and thankful to Dr. Judy McDonald. And please, Dr. McDonald, the microphone is all yours.
Okay.
Thank you. Yeah, this is wonderful, and it's a great opportunity to be able to do this before we do our seminar in November with the Latin American course. So I'm going to put my PowerPoint on, but so I feel like I'm a bit of a talking screen, not a talking head, but there'll be a really good opportunity at the end to discuss. Can you hear me okay? Yeah, you can hear me?
Yes, it's okay.
Good. So I'm going to do a share screen, and I'm going to start walking you through a little bit of history, and we'll apply it directly to neurosurgery.
Judy, Marcelo.
Can you hear me?
Yeah, perfectly.
Okay. Yeah, so it's this is a combination, I guess, in lead up to the Latin American. The plan is to go through with you a little bit about excellence and world-class athletes, where this whole thing began for me, and looking at how that translates into high-risk professions, which began with surgery, and then start defining the framework specific to pediatric neurosurgery. It's part of an evidence-based, profession-specific mental readiness skills that can be developed. And we're going to look at some tools that are being used right now in surgery as well as in other professions that can be borrowed. You know, frameworks are really transferable, so it's nice when you can use somebody else's hard work to make it work for yourself. And finally, looking at resiliency in new unexpected situations, so beyond surgery. And if you have situations where you really want to perform well, how you can try to make yourself as consistent as possible and get the outcomes you want. So that's the plan for tonight. So what's so great about Olympic athletes? What we found was they have a sense of balance between technical know-how, physical ability, and mental skills. So overall readiness comes from that combination of skill sets, as well as knowing the balance of that. And when you transfer that over to a workplace, then it's about risk management, because the people on the front line are the ones that really hit off the risk initially. And we're looking at groups that are the infrastructure for society, the ones that are expected to perform with excellence by the public. So when the work was done with the athletes, it's a great group because it's very measurable. I mean, did you go fast? Did you win? It's very clear who the top performers are. And because of that, they could measure that what they had in common was that the mental readiness skills were a major contributor to them winning. And also that if you can measure these skills and you can teach the skills, then you can potentially improve that performance. So that's why I think it's valuable to look into. So a bit of a history, I was involved with the back end of this work with the athletes, but I got to know the interview really well. And I thought, well, who cares about excellence? And so the group that came to mind first was surgeons, life and death. And actually, as a result of the work, the first work that was done, it was really transferable to other health professions. So the Red Cross in disaster emergency response, and social workers with the homelessness, global health researchers. So life and death was a motivator to be able to want to be consistent with performance. When you're dealing with police, I was seconded for 3 years to work with the police and develop a manual for them, looking at when there's a lot of money for training and the expectation for excellence, another group that's key for wanting this done. And finally, air traffic controllers, in Canada, we train them all in a central city in Cornwall. And I taught there for about 10 years looking at air traffic controllers. So they're a group where they make a decision that affects a lot of people. So again, really critical for consistent performance. And we'll get into some other situations where personal resiliency was really key. So when you take a look at crossing over disciplines and, how could you possibly do this? And so I found that there were some common traits that needed to be true to apply this same format. So when you're taking a look at the groups, there's an expectation for excellence. There's a period where you have to perform well. It's not all the time, but there's a critical period, just like the Olympic race, that you have to perform well. You're scheduled in advance. So sometimes advance is knowing an hour ahead of time, a day ahead of time. And the people we're talking about are the ones that are directly performing that skill. So it's not looking at the management team above, it's the people that are hands-on doing the work. And expected that when you're in this profession, you came with skills and training. So you're not starting from zero. So when you look at performance excellence, the idea of developing a skill set or curriculum or training is that you want to produce peak performers, and to do that, you need to develop skills that separate the best from the rest. So what's really important to know is this is not a random sample. I don't go into a workplace, ask if people could fill out a questionnaire or meet with me. It's specifically trying to find the top level people in that profession, which isn't easy. Olympics, not so bad because they've got medals around their neck, but in a workplace, you have to get particularly immersed in the culture and permissions, and to find out who have been identified as excellent performers. So anonymously and confidentially, I'm told who both their peers and their supervisors identify. So a critical question I would have in November, and also have with you right now, is, and I know there's different professions that are listening, but is performance excellence truly important in your profession? So depending on your answer to that, this could be potentially quite a short lecture. So if it's not important to be excellent, then what we're doing next is not really that important. You can survive doing, if it's not key to be in that position. So it's very valuable to understand, why is it important to be excellent, or why not? Do you have to be excellent all the time? Not everybody's excellent in a field, so how are they getting away with it? Is really to defend when and where that excellence is critical. So we have a survey that we've developed, and I'd ask if you can just either keep your computer or Word document online right now, or just grab a pen and paper. And I'm going to ask you about 8 questions through this presentation, and I'm really curious to get your answers. And it's best, that's why this is really great, is because I can walk you through the questions so that you have a background. But we're going to collect the answers from the survey that's online. Ricardo and Marcelo can explain where it's going to be afterwards, but it's the same 8 questions. So as we go through it, if you can jot your answers down, because it's great that it's intuitive. It's your first reaction to these questions. So if you can define, when you think of somebody who is excellent in your field, so think of an actual individual that you respect, what kinds of things make you feel that that person's exceptional? So what traits are making you draw that conclusion that this individual is exceptional? Can you just write down on a piece of paper right now 5 or 6 traits immediately that make you think of that person and why you respect them? So remember, these are the traits that you're judging create excellence. And this is a general definition. What we're going to be doing is making this quite specific to neurosurgery in November. But you can see some of the traits that come up repeatedly. The person achieves what they're looking for. They don't screw up. They're outstanding at something. They're enthusiastic. They take self-initiative. So this list is what we're looking for. When I'm interviewing people, I'm looking for these people, and that's where we're drawing the information from. And it's front line. It's not top down. It's the people that are working on this defining what they like in a coworker. What kinds of things are helping them get through the day with exceptional people. Another exercise for you. So it may seem subjective, but I want you to give some numbers to me. So as a pediatric neurosurgeon, or whatever profession that you're in, what does it mean to be ready? And I'm going to give you 3 definitions to take a look at. So are you physically ready? So your health, your fitness, you've got the proper protocol, safety in place. You can physically do the tasks. You are competent at the equipment or the computers you're working with. You hydrate and you manage fatigue. So that's what I would consider physically ready. You're technically ready. You have the knowledge, you can apply it, you communicate both verbally and written. You understand the organization, the community you work in, the culture of that profession. So you're technically ready. Mentally ready. You're confident, you're committed, you have a clear head with the big picture. You're trying to concentrate. If you get distracted, you can get back on track. And you can evaluate your decisions and cope well with what the consequences are. So those are the 3 definitions we're going to use for physical, technical, and mental readiness. So now, a little challenging, but do your best at this. I'm going to give you 100 points. I'd like you to divide that 100 points, if you can think of it a time or in general when you perform your best. So think of when you do your very best at the work you do. How much do you believe your overall performance depends on each of those? So would you split that 33, 33, 33? Do you think one is more important to the other? Can you actually identify those 3 numbers in that order of what weight you would give those 3? So scratch some numbers down now. And I'm actually going to show you across other professions what kind of numbers they come up with. So this is just ballpark. Remember, you're performing your best. And how you break down those 3 areas in terms of anticipating that you're going to perform well. Okay, so let me show you some numbers here. So let's take a look at the athletes. Any guesses how an athlete would break this down? The one thing I've learned is you can never anticipate what a profession looks like on the inside. So athletes, this is how your best people have identified that breakdown. Let me show you some stuff with police first. So police, this is the breakdown they gave. The surgeons. So we've got surgeons across 6 different fields. So neurocardiac, orthopedic, general, plastic. And this is the breakdown. Any surprises? And I'll just give you another one here, social services. So if you have these numbers, what kind of conclusions would you draw? I'm going to show you another list of players here, and this will be all people in the health profession. So let's take a look at more groups that are more similar. So we've got the surgeons and the social workers. Let's take a look at dentistry. Emergency responders. These are surgeons with the Red Cross internationally in the field. Pretty different from a surgeon in a hospital situation. And global health researchers. So we can, when you take a look at this, you can actually create, you can see that they're different. A lot of them are different and different weights as a general rule in different professions. We can take a look at these and compare them another way using another little grid. So if you take a look at this, I've got the last group set up. So we've got 0 right up to 50. And we've got the physical readiness, the technical readiness, and the mental readiness in the different colors. So let's take a look at what they have in common. So clearly all of them have mental readiness as one of the strongest suits. Interesting that the surgeons and the global health people have actually quite similar profiles. And that the dentistry and the social workers and the emergency responders have similar profiles. I mean, that's a great discussion point right there, and it's worth looking at even from looking at different professions, and people might want to transfer to different professions and understand what's involved. But you know, maybe because surgery, you've got an unconscious patient, global health don't have patients. Whereas there's a lot going on with a conscious patient for the dentists, the emergency responders in the field, and the social workers. So the fact that they have such face-to-face contact like that at the time of performing, it could influence the weight that's given. So certainly lots of ideas around that. And when you take a look at the physical readiness, again, the highest was with the emergency responders, and the lowest was with the surgeons. So crossing disciplines and looking at the weights is really an interesting thing in developing tools and so forth. So this is the framework that I use. Looking at, first of all, what are the challenges? So what is the Olympics to your field? What makes you want to perform at the best you possibly can? What circumstances? We took a look at sort of what the weight and breakdown is for the physical, technical, and mental. And when you take a look at the technical and mental in fields like this, the physical and technical are usually very well defined. They're measured, they're tested, no lack of definition with that. And the mental readiness certainly exists, but it's not isolated and it's not emphasized in the same way. So we have a model that came from the athletes, but we're gonna see if the 7 traits that existed with athletes, your best people, exist with the best people in your profession. And if it does, let's make it very specific to your profession and describe those traits in those fields. So let's give this a go. So if I were going to ask you this question, how do you get ready? Pretty tough to answer, and I get a lot of smart answers. I shower, so that doesn't work so well. But if I were to ask you very specifically, when you're in a challenging situation, so what kind of surgical procedures do you prepare more rigorously for, and you want a greater sense of readiness? So we start with that type of question, which is actually the 3rd question on the survey. And if I gave you, think of situations that, you have you move a little faster to make sure you're prepared, you're very still and you're more focused in that situation. So what about difficult procedures? What kind of procedures specifically to neurosurgery would you list? Are any particular patients or individuals that make a situation much more challenging? Surgery can be a simple surgery, but because it's this type of patient, it makes it really difficult, or a particular individual involved. Are there any complex situations? They're simple, but there's a timeline, or there's a deadline, or it's complex because they're run together. Are you in a situation where it's not you're not responsible, you have to teach somebody else, and you're ultimately responsible in the scenario without doing the surgery? Are there any special relationship pressures? So in surgery, maybe you're operating on your secretary's son, or something comes into play that emotionally gets charged. And is it the first time, first of its kind procedure maybe that administration is asking for, or it's the first time you've done it? So if you can think of a couple of situations, just intuitively, what would you consider to be challenging? And this is a really valuable list, because if we have people that are really experienced telling residents that these are the kinds of things that I find challenging, this gives permission for somebody just starting out to take these challenges very seriously and not be embarrassed to identify that it's an issue. So think about some things just intuitively that you find particularly challenging. Just jot them down. I'm going to tell you a scenario that happened to me, true story. So when I was doing this, I was, of course, I have to change the wording of an interview to make sense when I'm asking a surgeon, an athlete's interview into a surgeon's interview. So I was told, a surgeon, get ready by 8 o'clock tomorrow, you're gonna go into, it was neurosurgery, and be ready at 8, you're gonna watch neurosurgery. And I'd never done that before. And what's important is I don't know these professions. You know, if they tell me they paint themselves green, I'm writing it down. Like, I make no judgment, which is really critical. So no, I've not been consciously in an OR. So I go in, I call to a nurse the night before, and I say, what am I getting into? And she describes it to me, the clean area, the sterile area, you're gonna smell calcium when they go through the bone. And I get a really good picture of what's gonna go on. They're gonna cauterize, and I'm really, really well prepared, and I go in and I have no trouble. I take photographs, I got permission. I've worked with the public and first aid. I'm pretty good with blood and that sort of scenario. Went through 4 hours, no trouble watching the neurosurgery. It was tremendous, it helped me. I was very focused on the things I wanted to see. Great experience. 6 months went by, and my father got hit by a car, and I was called into the emergency, and I was, it turned out he was okay. He had a small laceration just on his forehead, but it turned out I knew half the people that were there. By this point, I had gone around the 5 hospitals. We were right in the middle of the research. They're saying, hey, how's it going? And I'm telling them about what's going on. Anyway, we get to my dad, and like I say, everything was fine with him. And the doctor said, are you gonna be okay? We're just gonna clean out the cut. Oh, of course I'm gonna be okay. Without a lie, they pulled up the flap of skin. I passed out on the floor. I woke up in the bed beside my father. And I went, whoa, what was that about? And you know, this was a difference. If you had lifted up a flap of skin on anybody else, I would have been totally fine. But this was my father. And I realized, well, I'm doing no good in the bed beside him. So I took a couple of deep breaths. I thought, get your act together. You're far too cocky. And pull back a little bit, prepare differently, and get over there. So I did, and I was fine the rest of the time. But everybody has their own scenarios, and you've got to know what are the difficult things in general in your profession, but what is specific to you. So this special patient relationship or relationship is a big deal on typically a normal situation. So I hope you can relate to that. So here's the list that came from research. So this has got everybody's surgery in this, all the different types of surgery. And the list isn't so important right now, but what is important is it's a great exercise. First of all, it's a great profile of surgery. If you want a great job description, these are from your best people saying what's a big deal in surgery, including, you know, everything. Routine surgery is critical. But if I were to get a group of people and give them a sheet like this, okay, I want you to underline what things you're particularly comfortable with. You feel you can handle this situation pretty well. Cross out the ones that don't apply and circle the ones you find challenging. So from that, you get a very personalized profile for yourself of what to work on, potentially for curriculum design, what things are particularly challenging for most people if you're going to do case studies or develop any kind of scenario building. So great list, and that's the first part of the framework. You know, here's the outline for the emergency responders. And again, the words aren't critical, but you can see very different scenario, totally different situations are flagged, and a great list for somebody new coming in to see what's a nice overview of what's challenging in this field. So readiness, the next question is, again, can you tell me intuitively, if you're dealing with one of these challenges, can you define what ready means? What does ready mean to you to be ready to do these challenges? So again, just if you can just take a look and on your paper and just define what you feel would be ready. Okay, so if you take a look at that model again, and you can come up with some pretty generic outlines for physical and technical that will apply to most occupations. Of course, the lingo and the vocabulary have to fit, so that has to be massaged. But always you can go into job descriptions, you know, work plans, and you can get a very clear definition of what physical and technical readiness is. But the mental readiness is a little tougher, and so that's where this model comes from that came originally from the athletes. So we're going to take a better look at this model to see how that fits into this story. So the model has 7 components. In the core is commitment. So, you know, having feeling responsible, having empathy for a situation, you know, having high standards and putting that time in, the commitment. That's one of the things that with sports that a coach is trying to come up with. Is this person going to stay committed for the next 4 years? It's one of the biggest determinants whether you make a national team or not. So commitment is key. Self-belief and confidence. So what does that look like? Are you just born with confidence? In our work with surgeons, clearly you acquire that confidence. But what's the difference between confidence and cocky? And somebody can put a lot of work and a lot of effort into something, but when push comes to shove, they haven't got the confidence to complete the task. So commitment and confidence are quite different. Positive imagery or visualization is actually one of the separating skills that a lot of really elite people have honed really well. And clearly it's used in surgery. So looking at practicing before, during, and after events, recalling situations, and trying to really see in your mind's eye what's required. Mental preparation. So what are you doing a minute before surgery, an hour before surgery? If you have surgery on Wednesday, does your Tuesday night look different? So do you have rituals that you do consistently? Probably you're not even aware of them, but it allows you to be very consistent and predictable when it comes time to actually doing it. Are you able to stay fully focused? So can you concentrate for the full length of time that's required when you're performing? Is it necessary to concentrate the whole time? Are there down times that you can actually relax? Do you understand the flow and the rhythm that goes on in the surgery that allows you to pull back when you have to, but be very focused when you need to be? And you do get distracted. So what are the distractions, and how do you get back on track very quickly, not lose focus and concentration? And that's, again, like imagery, the distraction control is one of the key areas that separate people. And concentration, or sorry, constructive evaluation, being able to accept feedback and work with that in terms of looking at the decisions you make. And, you know, a bad day in these professions and in surgery is a really bad day. And how do you cope with that? What are you doing to be able to continue and do the same surgery an hour later, a day later, next week? So that's the framework that we're going to look at to see whether the best people in a profession have those same traits. And if they do, what does it look like very specific to that profession? So I'll just give you a couple of examples. We can't go through all of them, but let's take a look at positive imagery. And if you can think of times where you use it, what times does it seem important? Do you try to take a two-dimensional diagram and try to make it 3D? And every profession does it, and they do it a little differently. So air traffic controllers, this is an air traffic controller in a tower as opposed to a center. And you can see that they have strips there, and each strip has speed, distance, and altitude, and they'll cock the strips to determine which ones they have to pay attention to. But they have what's called a mental model, and they hold in their mind, and they're pre-tested for this, where they have to try to remember where these 13 planes are. And of course they're moving. So they in their mind, imagine 5 seconds, 10 seconds, 1 hour later, what's gonna happen and where do they have to be at that time. In this field, actually, sometimes it's not what you see, it's what you don't see. And one of the biggest problems is they don't see the truck that was put on the airstrip. So they actually teach them very specific scanning skills, and they practice that with visualization. Social workers, getting their head around talking to a team. What's the vocabulary? Police, while they're driving, they're looking at acronyms and they're imagining where are they going to park that car when they get, where's the access points. So their time for visualizing is often as they're driving on the way to a 911 call. So in neurosurgery and in surgery in general, what was found is that clearly positive thinking was across the board. And visual imagery was used in very specific places in surgery. So we can drill down and actually get a sense of, you can see that most people have some sort of psyching they do beforehand, and lots of different other ways of being positive throughout surgery, and different, not necessarily consistent. People are positive in different ways, so you don't all look the same, which isn't necessarily true for all the other dimensions. Like sometimes everybody does it the same, and often there's room for flexibility on what skill sets you have to look at these things. Visualizations used in preparation and calling a surgery to try to remember what was done. So some scenarios of where that was used. So clearly there's various approaches to positive thinking, but the surgeons we spoke to definitely visualize in preparation or in recall. And this is a really strong skill in sport because they can't always be in the arena that they work in. So literally you can get a top swimmer like Phelps, sit him in a chair, tell him to close his eyes, run his race, and when he says I'm finished and you look at the stopwatch, it's within seconds of the real race. He knows his strokes so well when he rehearses them that he can duplicate that very easily in the pool. So going over and over the distractions. And the same thing can be done for the OR, where you're visualizing what can go wrong. Those are the kinds of things that come up. Let's take a look at focus and refocus. So what does that look like? People talk about being in the zone, having that ideal mindset. Air traffic controllers, again, depending on where you are and the shift work, it has a different look. But what does it look like for surgeons? 100% are totally capable of being able to concentrate, and they're able to do it in a relaxed and calm manner. So it's being described as almost an oasis in the OR, where you can shut off the rest of the world. That's not where the issues come up, is when you're operating. That's why you got into being a surgeon. That's where the enjoyment comes. So anticipating the next step, the things that you do while you're focused, right? So you're controlling the energy. It actually becomes effortless when you're doing it, and you're really in a position where you can practice being in the right mindset. So excellence for surgeons, clearly good surgeons can do it in a relaxed and fully concentrated way. And what's good is this type of work creates lots of mentoring quotes. So in this particular, a neurosurgeon identified that I'm focusing in the layers. Sorry, I can't see because of the below the skin. Each step has its own focus, and it goes on, and you can really get your head around the strategies around focusing for that particular surgeon. Focusing isn't just in the OR, it can be in consultation. And so whether you're visualizing, you're creating rituals, having cues, and emotionally trying to control things. So real strategies that are being used get pulled out, you know, like lowering your voice to try to stay calm, or, you know, instead of when there's a panic situation, a crisis situation, there's always a brief pause where you can put your hands together and reassess quickly before acting. So putting your hands together, being still, was this particular surgeon's strategy. So in discussions with residents, we can come up with some scenarios and get them to pick the ones that they think would fit for them. And also maybe there's some ones that they didn't think would work. The strength about the nature of this work is if you see something, you say, well, that doesn't even make sense. You can't argue it because it came from somebody who is identified by their peers and their supervisor as being exceptional. So in a certain circumstance, that strategy really works. And it's really important to have a range of strategies. So if you take a look at the blocks in surgery, there was a lot of different situations that were identified before, during, and after surgery that can affect your actual performance, whether it's the performance that you're doing at that moment or the next performance if it was something that happened after surgery. So this list of distractions and issues again, and the types of strategies that are used around that. I want to flag something that I always look for because we're talking about people that are well-trained, often A-type personalities that are really anxious to do the work that they're trained to do. And one of the areas that's particularly difficult and often is one of the highest stressors but has the lowest number of distraction control strategies is downtime. So downtime that's unexpected, the operation was scheduled for 8:30, now you got to get ready for 10 o'clock because it was canceled, or you drop equipment on the floor and you have to wait for it to be re-sterilized. So scenarios where you're not expecting it, this downtime can be a real destroyer of concentration and what's going to happen next. So a fifth question on the survey is, and again, if you can write this down from your gut, if you were mentoring a new pediatric neurosurgeon, what would you tell them are the top stressors or issues in that in your work? And if you're in another profession, answer it for your own profession, but just list 3 things that you think are the big deals, the big stressors in that job. And it doesn't have to be in the OR. It's undoubtedly there's some administration issues that happen everywhere. So think big and think about what you would flag for that new pediatric neurosurgeon. How are we doing? Are we still on track? Everybody's good? Another question, same kind of idea, but what would you say are the standard rookie mistakes? So in pediatric neurosurgery, what would you flag that you see consistently are rookie mistakes? Good for them to know, good thing to put into case studies and to flag. So the sixth question on the survey is standard rookie mistakes. And our plan, when you complete the survey, is we're going to bring this to the course on in November and be able to show people the kinds of lists that you've come up with. Okay, I just want to go back to the lulls for a second and looking at strategies that came from some of the surgeons, and again, very different strategies. There's lots of them, and leaving a situation and just relaxing when you can't do anything about it, so just leave. But you have power, so sometimes you can push through that and get people to change what's making that downtime, or you can anticipate the lull and try to change it. So again, you can drill down and actually get the strategies around that. And it's important for people to have a lot of strategy when they get into a situation. So here's a couple of quotes here. This person thinks positively and they shift tasks. I just continue working and shift tasks. I stay there all the time. Usually I don't drink or eat or do anything. I just go on and on and on, and I don't like to stop. I get too relaxed. Another one. What I try to do is say, no, I will stop and wait, take a deep breath, until I get what I need, the more sophisticated equipment, rather than going back to fork and knife surgery and maybe wishing I hadn't started. So I find that that takes self-discipline. And you know, this is really encouraging to read. You can see I don't edit much, and it's encouraging to hear from an education perspective, mentors and adult education that can really develop good, strong strategies for new residents, and also people that have been in the field for a while. They can look and to see what people are doing, what their strategies are. The seventh question is about mental readiness. So as a neurosurgeon, how would you define specifically mental readiness? What does that mean to you in your own words? And it's great to have really candid comments that other surgeons can relate to. So can you jot down right now, just from your gut, what do you think mental readiness is? Okay, and when you take a look at your own strategies for mental readiness, things that you do before, during, and after, is anything that sticks out in your mind as being, you know, particularly it works for you, and it's something that you think might work for others? It's you know, it's maybe something that is really simple, but for you that gets you in a state where you feel mentally ready for the surgery. Can you put a few things down of strategy that you use? And you know, another issue about accepting feedback and evaluating, in these fields, you're very accountable, and there's so many ways that you get feedback and evaluation, but where do you get your feeling of success from? And what makes you feel like it worked? And have you developed some strategies around how to evaluate that performance? So it's, you know, the objectives, having teamwork, maybe you did the first of its kind scenario. You know, what does success look to you like, and how do you evaluate something? Not just necessarily the objectives, but there might be other things that you go through in your mind to know whether that went well. And if it doesn't go well, how do you cope? You know, what do you work with to be able to get back on track? And I think when I look at different professions, I think the strategies that came from surgery are some of the strongest coping strategies I've seen. And it's ones that can be shared with other professions, that other people can learn from what goes on, you know, with the kinds of issues and the severity of success and failure in surgery. You know, knowing the statistics that you're going into, what's the percentage of failure, what's, you know, you can improve upon it at least and draw conclusions and draw different conclusions after something. So tremendous list of coping strategies that come from this field. So again, this is the framework, and I walked you through, you know, having a profile of what the challenges are, what's the importance of these three areas, and what weight would you give them in different situations, and drawing out of it physical, technical, and particularly the mental readiness that can be separated now and isolated for teaching purposes, for curriculum design. And you can take that, again, when you take a look at, when you take a look at this model, and again, the scenarios that are generic, you can make it into something that works specifically for that profession, that is very tailored to the information that you get. I'll just show you one that was developed that's really a clever tool that is really easy to translate into other fields. So this was the weight in policing, and they developed this only took a year. This is 12 items that are the, for a fully functioning officer, working with a coach officer. So you can see that the week is exactly the same as what was given over there. The vocabulary is the same as those other ones, but we use the vocabulary, use of force, for example, instead of fitness and use of tools and so forth. So it gets boiled down to what's important. It gets boiled down to be the same weight that's represented, and then it goes into the different mental readiness as well. And what's great is this can be translated into literally a 2-pager that has each of these, so knowledge of applications there, a description of what that means, and the officer, the trainee, carries a sheet like this around for 2 weeks. Every call they take, they write down how they've demonstrated these things. At the end of the 2 weeks, they sit down with their supervisor and they go over, and first of all, do you comprehend all of this? If you comprehend, how competent are you? And ultimately, are you fully competent? So it's, one of the framework was actually borrowed from nursing, but it was really boiled down into a really usable tool in working with the police. So the groups that I've worked with are in medical detective services and public safety and human resources. And it's great to be able to look at strategies across all these different groups and share those things. And again, these groups are expected to perform with excellence, and they really are the core and the infrastructure for society to keep functioning. So if, from a population health perspective, this is a risk management strategies, because if these groups continue to function well, then it's the foundation for a society functioning well and population health happening. So again, lots of different tools, and we're using a tool that has a proven standard assessment tool for high performance skills. It has a frontline perspective on what works as opposed to top down. And it has mentoring and leadership quotes from informal leaders that have been identified by peers and supervisors combined. My Portuguese, obrigada. And I wanted to identify some of my collaborators in yellow, groups that have worked in the health profession. Certainly Dr. Ricardo and the Brazilian Society of Pediatric Neurosurgery and the Latin American course that's coming up in November. It's going to be wonderful to work with that. Just to summarize, so we've defined excellence, success, and the challenging situations that are in the profession. We recognizing the importance of the technical, physical, and mental readiness that's to perform well in the profession. And we're defining very specifically the mental skills that for the front line that can be measured and taught and improve upon the skills, and collect the readiness strategies from these exceptional professionals, and for that frontline preparedness and operational readiness training, and made that link between the front line performing well and the risk management for the organization. Thank you. It's over to you, Ricardo.
Thank you so much. So now we open for a discussion. I have some questions. I can see in this list there are a lot of good skilled neurosurgeons that I know, very experienced neurosurgeon, and as well we have trainees. We have different people in this list. So we are open. If someone has some question, we are open for question. Marcelo, if you have someone.
I do, but you know, might as well just open to the rest of the audience. And if nobody, if there are any questions, I might as well just ask a couple of questions myself.
Yeah, Judy, I have one question. It's a very interesting. When I see the wheel of excellence, it's always complicated for me to see the 7 factors and to manage how can I improve all of them. In my opinion, personal opinion, for me, I elect 2 main factors. It's for me, in my profession, personally, it's the most important factors that are the commitment and the full focus. In my opinion, if you have the 2, you can manage the other one. What is in your opinion?
Well, you know, things come up at different times where they're important, but I would say that the 7 are really important because you can have commitment, but if you don't have the confidence with that, you know, you can have, so let's say we have commitment and we're fully focused. What happens when you have a distraction? Like, distractions are killers, you know, knowing what can happen that gets you off track. So I guess if you expand focus, and because actually we did that with the police, and you can look at focus and include sort of distraction control, like focus and refocus. So sometimes you can combine those 2, but I keep going back to the 7 because they're the things that really made the difference. Those were the things that separated a really great performance from not. But within those 7, sometimes you're right. There's certain areas that are more important in some fields than others. Not that the others aren't important, but certain fields, the nature of the challenges that happen may require a higher level of confidence, for example, because of what they're dealing with. Or that field may have to be particularly good at handling distractions. If you take a look at even in the OR, or certain situations in hospitals, there's some jobs where it's incredibly distracting. And if you haven't got a full plan, or you're just not selected to deal with that, you're going to run into big problems. So you're right that some professions, they really, you can prioritize which things to go over first. But I would certainly make sure that, because what we do is sometimes combine areas. So if you're evaluating, for example, you might combine commitment and concentration, or commitment and confidence in a category. You may not evaluate that with 10 things. You might only evaluate it with 2 because it's not as important as something else that you really want to define for focusing. A lot of times when you're running a scenario, like let's say you run some sort of a scenario, focus might be the most important thing in that scenario. Whereas some other situation that you're running, maybe you're going to do a case study where you're dealing with distractions. So sometimes you can move around and look at and train for different things. I like what you said about, you know, personally though, there might be 2 things that you want to work on, or you feel that's what gives you the strength. You know, I think everybody has their own personal slant to all this as well. And there's areas where maybe they personally want to improve on, or they feel that those are the things that they've really excelled well in that help them go through. So there's a personal side to developing a profile as well.
Okay, thanks.
So just if the audience would like to ask questions, feel free to, you know, unmute your microphones and start your videos. Judy, can you get access to the chat screen over there? Because we got some questions. Some people have written questions for you. There's a chat icon just, you know, below your screen. So if you can check that.
Got it.
Otherwise, I might just read them for you. But if you can see them.
Yeah, go ahead. If you want to pick.
Yeah, go right. Maybe it's better to read for her.
Yeah, maybe identify it, sure.
Okay, so we got a question from one of our colleagues, Mateus, who says that he believes that neurosurgeons are usually very arrogant and narcissistic. And he thinks, do you think that it can disturb mental readiness techniques? And have you found any differences in that matter between neurosurgeons and other professionals?
You know, I get asked about personality traits a lot, and you know, in the different groups that I've met, and you know, I've really been fortunate to work with really you know, skillful people, and I can tell you that when I meet with these people, sometimes they come in and they're so humble. I mean, so humble, and I've got to pull out the answers from them. And others, I mean, just get out of their way. You know, they're gonna accomplish what they want, and they're clearly confident in what they do. So I find personality is not the consistency, although you know, you can target that. But what they have in common are these skill sets, and you can really pull from them. And even though they do things a little differently, you can pull. If I go back to those 7, you can always find those things in spades with those individuals, even if they have different personalities that come into it. Because I think you can see that there probably are some traits that, you know, when you look at whether it's through selection or recruitment or what the profession makes of you. But, you know, for example, coping strategies. You know, some people, they're concerned about the batting average, you know, but other people take the most difficult cases, and they're willing to have a high percentage of mortality because they're taking on the more challenging ones, but they know how to defend that. I mean, you know, is that arrogance? Is that understanding the field? You know, my focus is on the skills that they bring forward. And when you look at the skill sets that somebody has, you look past the personality traits, especially if they've got a record of being successful.
All right. So you don't think that has any interference on their skills, these personality traits? I mean, if they accomplish what they want.
I think we all have times where, you know, you have to put yourself in check if it's not working for you. That's for sure. Like, I mean, I was like the story I told of my father. I mean, I was just far too cocky. You know, somebody, you know, I watched in the OR where someone's scrubbing up, and the veterans are talking about the football game and whatever's going on, and the junior resident is trying to fit in with that group and trying to get into that, but it's so new for them. If they get carried away into something that's not getting them prepared properly, you know, if they get arrogant at the wrong time, and it doesn't fit with what they need to prepare, then they're going to run into trouble. You know, that may be. I mean, you know, I was far too cocky going with my father. That was, for me, that was a big deal. That was a special relationship. I should have flagged that. I will flag it from now on. Like that takes a different level of attention than somebody else that was in the same situation. So I think, you know, you have to put your own personality in check, and have some sort of a framework that you work from, that you can make sure that you're preparing properly for yourself. Because it is different for different people, what they need to prepare. Some people can do it in a heartbeat. Other people need more time. I think it's knowing yourself is more important than what other people think your personality is doing for your profession.
Yeah.
I'm not a psychologist, though. Like, I really take this from an education point of view. I really don't try to analyze the psychology of things. I really, my perspective is from an adult education, and these are difficult professions to master, and you're taking people and trying to ensure that they're as consistent as possible. So, you know, having a plan, to me, is the way to push that.
Judd, we have another question. In this room, we have the two the two directors from the Latin American course in November, Simone and Eduardo Jucá. They are watching us, and Eduardo asking about if mindfulness techniques can improve surgical readiness, in your opinion. The mindfulness.
Sorry, just mindfulness.
Yeah.
Yeah, that's becoming you know, it's terminology, right? I mean, definitely that's you know, when you take a look at some of the strategies that were brought up, meditation, praying before I mean, people have their own personal strategies, and certainly you know, pulling down your stress level and using techniques like mindfulness is excellent. It certainly is a strategy that a lot of people work, and it's quick, right? It's trying to find things that that can be done quickly, even just taking a deep breath and reminding yourself of what's going on. Borrowing strategies from other professions that will work for you in your situation, adapting it. But yeah, I know we're doing in the hospitals, we're teaching mindfulness, and it's really it's a methodology for trying to get focused and trying to block out what's not important, but still be aware. And I think one of the good skill sets in focusing is not just focusing on the present, but it's the ability to actually anticipate what the next step is. And that's not just mindfulness. That's pushing, so you almost have two channels going, you know, like you're anticipating what's going on next. So that ability to, you know, for lack of a better word, multitask, but it's being in the present moment, but also, you know, good people know how to bring on the next steps that are coming up. So it's doing both.
So we got another question here, Judy. I'm not sure if I understand it, so I'll just read it thoroughly. There's somebody in the audience who asks, according to mental readiness, what would be your advice to those percussion bosses?
The which bosses?
If there are some difference between the pediatric, the general pediatric surgeon,
there's a question.
There's
a question just above that.
Oh, okay.
He says percussion bosses. I'm not sure what he means by that. Whoever's asked Hunga's fire can come up and say what does that mean?
Yeah. I used to those.
Is he still here?
Can I maybe ask something?
Yes.
Yeah. Thank you very much, Judy, for brilliant. Hi, I'm a neurosurgeon working in Brazil. Thank you very much for a brilliant talk. Very enlightening. I had the opportunity working in UK until last year. The NHS offers, for instance, mindfulness program for medical staff working in different hospitals, right? Did you have something like that in Canada, like an official program for medical staff to improve mental readiness? And do you think this is something valid to invest, to offer, like as part of medical training, something to improve mental readiness for doctors, not only surgeons, but in general?
Right. Yeah, I think it's something that can be done in a really broad scope. Like, so we were doing it with residents in several hospitals in Canada. I've worked, like say, some of the other professions that have used it are air traffic control and police extensively, and they put it right into, and everybody wants something. I find you have to decide where it's going to go. Like, for example, police did it with coach officers. They developed with their supervisors how to train other people. So the focus was on train the trainer and getting the different evaluation methods that is used to incorporate the mental training in for the supervisors to work with the trainees. So that was where the focus was there. With the air traffic controllers, it was directly with the trainees themselves. So a little bit is what you're ready for. Like sometimes it's just developing a tool for evaluating. So you know, looking at and like we did it actually with California Hospital, where we took the current evaluation tool, and and clearly it's not that mental readiness is lacking. It's within evaluations, but it's just not isolated and separated. So what we did was we just kind of worked around, just changed it, worked with what was existing, but to be able to show people the different weights that respected the, you know, what seemed to be the case. So it's not changing things, it's just adapting it. And it worked really well, so because the residents could clearly see what they're being measured on, and we defined the mental readiness more clearly. So I think it depends on where a hospital is at. Like any part of this can be usable. So The mindfulness is often a package, right, that you can get online even and work on. But like some of the tools that are really easy to develop is the evaluation tools. Having actually a course like this that's done maybe one, you can, I mean, I've taught it for nine classes, or I can do it as an overview, right? So it's whatever level the group is ready for. But we're gonna we're gonna do some test driving in November, and actually walk through some really good exercises that hopefully those people can walk away with some new strategies and develop some personal skills. So yeah, I totally believe in it, and I think it does make a difference. The impact, impact statements, whether it's from the classes that we give or from the administration, there's usually pretty good buy-in when they see it. I mean, I'm curious how does it ring true for you, what you saw, like some of the stuff that I was talking about, do you relate to it?
Yeah, so yeah, I had the opportunity of going in some of these sessions. I think was really helpful indeed. The other question I wanted to ask you, if I may, I don't know if anyone wants to go first, but I don't know if you're involved at the moment with medical staff dealing with COVID-19 patients in Canada. I think a lot of people are going through a lot of stress because of these people in frontline. I don't know if it's your field of expertise, but do you have an idea of the psychological impact that these people working so hard in frontline will have in the future, in the next months?
Yeah, it's amazing. It's just such a new area, and I always have distinguished my work. I really don't talk about mental health. I mean, because that's an area, like when you look at PTSD and mental health, that is an area where you're looking at crises management. And I've always looked at the stuff that I do more about personal resiliency and going from like being consistent in your performance, right? So there's a bit of a distinction there. But I am looking at what you're talking about, and I guess we're actually looking at developing a course at our university, and the proposal that I was asked about was looking at productivity and mental resiliency. So trying to figure out what does productivity look like, maybe redefining what can be accomplished so that you're actually going after something reasonable, and what does building resiliency look like? Do you see the distinction I'm making between sort of saying that this is PTSD and a mental health problem? It's sort of taking it a little bit in the other direction, but it's blending, I think when you take a look at any problem, when you start asking about physical, technical, and mental, and you ask good questions, you come up with a very different look of the problem. Can I have 5 minutes. I was going to just show you, one thing I did miss was showing about how to create peak performances yourself. Do you mind if I take over the screen for a second and do a 5-minute wrap up here? Is that okay?
Yeah.
Yes.
Yeah, I should do that. I'm going to just show you something here, just to share with you a scenario. So one of the things I had on my agenda that I haven't quite discussed yet is, what about creating personal resiliency and unexpected situations that you're thrown into and that go beyond surgery? I mean, life after surgery, how can you kind of apply this stuff in a totally different area that you're not used to, which I think it does address this whole COVID thing and a craziness that we get thrown into. And I really stand by this process that I walked you through here, that it really helps to clarify and come up with personal strategies that will work. So I have a story to tell you, and that is that one of the groups that approached me was from Nepal, and it was the Nepal government, and they wanted to increase their tourism, and they thought, well, we'd like to have you work with our Sherpa guides, because they wanted to brand the Sherpas and enhance their safety. And so, and I thought, well, yeah, Sherpa guides, you know, this is, does everybody know Nepal and the guides, they do the mountain climbing and the trekking in the Himalayas, right? So clearly they're well known as being the best climbers in the world and so forth. So I thought, yeah, that'd be an interesting group to do. And like I say, when I work with the police, I went on ride-alongs and I was tasered, bitten by dogs. I drink more coffee just to get used to what their field is all about. Well, their idea of a ride-along was going to base camp. So in 2011, the challenge I had before me, which was not on my bucket list by any means, was to go to Everest Base Camp, which is 9 days up and 6 days down. It is an altitude of 5,600 meters, and it's 6,800 feet. So that was my personal challenge, which was kind of like COVID, you know, like I'd never dealt with anything like that before. I thought, well, you know, put your money where your mouth is. Let's see if I can use my energies to make this work. And I asked really different questions, and I think I trained differently than the people I was with. And I'll just walk you through some of the things that it made me think about. So the physical training, of course, we trained in mountains, and somebody says, well, you can't train for altitude. And I actually, you can train for altitude. You can get an altitude tent, and you actually can increase your hemoglobin. So physical training, I did, you know, worked hard, and you can see that, you know, you have to learn how to, you know, how to get clear water and all the things that are involved with the physical training. Ask good questions about that. Technical knowledge, well, you know, the culture is really important, and having good resources from a technical point of view, more than just the equipment you're wearing on your back. I mean, I had a cell phone in my pocket that went to these friends of mine that were in Kathmandu, so that if something went wrong, I had good resources on the ground. So mental training, you know, the focusing was pretty important. And I got to tell you that day 3, I almost quit. Like we stopped for a break. I was gagging, and we were supposed to hike for 6 hours that day, and we were only at hour 2, and I was ready to pack it in. This is one of the dumbest ideas I've done. But, you know, after the break, somebody says, let's go. And I put my boots back on, and somehow 4 hours later, I ended up where I was at. And I realized that, you know, it's a very complicated situation, but actually when I realized that it's really about one foot in front of the other, like really that's as exciting as it gets, I actually had a good time. And I refocused on what was important. It was one foot in front of the other. That was as exciting as it got. And once you figure out, you know, what you can accomplish, it worked. And I did go through those 7 things. I kept keeping them in check. And I often evaluated to think, I don't care if a Canadian flag is at Everest Base Camp. Like, I'm ready to pull out of this thing if it doesn't work. And I reevaluated many times. And end of story is I got to base camp. It's a rock. It's all base camp is a rock. And more importantly, I got back down again. So I applied this stuff to something very, very new to me. And I would say that, you can do that. You know, you can apply the methodology into strange situations and come up with a new perspective that you might not normally have. And it's really simple. Like, those 3 things are simple, but they're, you know, knowing what the challenges are, what the challenges are going to be to you. So with COVID, what are the challenges with COVID? It would be really interesting to get the frontline people to identify what the challenges are. And I will guarantee you that the challenges they have, you will never be able to guess. I mean, if you're in the front, but somebody outside will never anticipate that list, ever. It's so different than you expect. It's never what you think. You know, the administrative issues that are really a problem, the relationships that come in and where that comes in, the challenging people, it's a list that is so special, and it would really bring focus to what the real problems are with COVID and get people to identify what's important to them. So I would suggest that. And so I think you can create peak performances. It's really cool, actually. And no matter what the difficulty is, you can apply this strategy. So thank you again.
Thank you very much.
Judy, I just got some clarification on the question I was asking you before. So we got a question from the audience. He's actually asking whether you got any advice to what he called percussion bosses, which are bosses who put their trainees under pressure. Is there any way you can actually make them better trainers or mentors?
There's a couple of things that, you don't have too many aha moments. I mean, obviously people do things because they believe they're doing the right thing, or they, sometimes simply sharing the life of somebody else. Like when we did it with the police, the senior, we actually did it with the senior management as well. We developed a profile for the senior management. And it was interesting for the senior management to come up with a list of what their challenges were, what a day looked like for them, and for the trainee, for the police trainees to look at what a senior management day looked like, and for the senior management to look at what a trainee's day like. And it was from the front line, from their own perspective, not from what somebody else thought it was. And that's what I mean. You always get surprises when you look at what somebody else's day looks like. So sometimes sharing that is something that's pretty anonymous, right? I mean, that list that I showed you is, you don't know who said what, but it's a really good picture of what both jobs look like. So I think that really worked. And I think appreciating a new perspective always works. So I know the same problem has come up where we did a presentation to management, and it does get them to think differently about what's important. Like if you go back to the list that you wrote about what's excellent, and if you ask a manager, like what do you think is an excellent trainee? Like describe that person. Like think of somebody you think is really exceptional. What traits do they have? And get them to write down, 5, 10 traits. Make that list. And have them put beside those traits, which traits are physical, technical, and mental. So how are they judging those people ultimately? And I'll put money down that the majority of things that they put down are mental, that's what they're looking for. And so if that's what they're looking for, that's what they have to train to. And granted, you have to spend more time on things that somebody doesn't know, but you've got to put the effort in where it counts, where the things that you're actually judging, the traits that you believe make somebody excellent. And we overlook those traits, yet they're the things that separate people that they think are great and people that they don't think are great. I mean, I haven't got the answers, but I know that was something that worked in other fields, like letting them see something like this and getting their feedback, like I'd be curious to see, just to have a discussion. Like I'd be curious to have a discussion about what they think works and what parts of this might work in. Anytime I've worked with a group, it has to start from the top down. Like the top have to believe in it. And then from there on, it's the front line that runs the show. And I think when I've done it, I've gotten the respect of both groups to pull this together, because it does require the consent of the people that are managing the situations. They have to buy into it for sure.
All right, excellent.
Okay.
Any other questions from participants, from the audience?
I'd be curious on next steps, like what things you think are the most valuable in neurosurgery as next steps. Like where is the need in terms of mental readiness? Like is it in the, is it in with the trainees or with the management or with the people that train the trainees, the direct supervisors of trainees? Like where do you think it would fit? Where does the fit look best right now in this field?
From my side, I don't think I have an answer to that. I can just think of a couple of things from the top of my head, but it's quite difficult. I don't know. I don't know which direction it is taken indeed, but I don't know. Maybe somebody.
Sometimes it's recognizing too.
I'm very straightforward in that matter, so it's kind of hard for me to think from, you know, to think outside the box, especially in that topic. So
sometimes with the new technologies that are the changes that are going on in a profession, just pulling together the strategies from people, you know, before people leave a hospital, before they just gather up the strategies that are working, and having that sort of like a manual of strategies almost that are more candid strategies as opposed to technical strategies, really the strategies that seem to be working for the people that are succeeding right now, or even from everybody, but when they know they're doing well, what works well when they can pull it off. And just getting a collection of those types of ideas, it can go a long way.
I do still have a question of my own, but anybody else has any questions? Anybody from the audience? Any of the participants?
Just Simone, thanks you.
Yes.
Yeah.
Hello, just no question, just to say hello, nice to meet you. Well, I'm Simone. I'm helping Dr. Ricardo and Dr. Juca with the next course, and it was an excellent presentation. Many things to learn, so we are very anxious to have you here next November. I think it's going to be great. Thanks a lot.
Thank you.
Let me just ask my question then. I think then we can go to the final remarks. So you talked all the way about, you know, the very complex situations which we face, and to which you got to be ready. You got to have the readiness, as you said. But I don't think that any surgeon can help not having a couple of very trivial situations. So operations you do all the time, you know, operations you do every day. And it's quite easy to overlook those situations in the sense that, you know, you feel relaxed and say, okay, I do this every day. I'm not going to have any complications and so forth. But I've always felt that these were the circumstances in which you actually have problems. Because if you focus, as you said, on something, it's quite difficult. But if you just feel, okay, I'll do it. Is it possible to actually avoid that? Do you think that's something that comes naturally, or is that actually a problem? Am I thinking well, or is it just something that, you know, we can't have that? I mean, you have to focus even for the smallest of the operations, for instance, in pediatric neurosurgery.
You know, it's interesting how many years on somebody has. You know, you take a look at the skills that you have, and you don't, you know, as your career advances, your skills just don't go like this. You know, sometimes when you first start a career, your skills are up here and they kind of go down the middle. Other skills, they peak in the middle of your career. Other skills, they peak at the end of your, you know, different skill sets that you have changed throughout your career. And I remember that it does come up where routine surgery can be the most challenging, you know, to stay focused. And in particular, well, one of the things that I remember one surgeon talked about his first 10 years, and the first 5 years, you know, you're learning, you're getting to see different things. You're confident, but you really haven't seen it all. And by 10 years, you've kind of seen it all, and you start getting a bit confident about what's going on, and that, you know, you've seen it and done it. But until you have the really big one, like the really big error that changes everything, when you feel totally vulnerable that you made a mistake that was so avoidable, and it probably was in something that was so simple, until that happens. And this one doctor had said, you know, after that, I had no trouble focusing on the routine stuff. Like, you know, you think you've seen it all until you see that. And, you know, it's still, I remember more than one person was talking like that, but there's a point in your career where you get it, and you prepare differently for that. And I can tell you that similarly, you know, every field has that, and I can tell you that not to change it's hard to talk about another profession, but this is again, it just gives me the down my spine is with police officers. You know, same thing. They have an alarm that goes off, and the same alarm goes off once a week on a Friday because the same guy isn't locking up properly, and they think it's stupid, and they send one guy in instead of both of them going in to check because it's just, you know, they're anticipating that it's the same guy, and so complacency can be really easy in a lot of professions. And we interviewed 48 officers that were excellent, and they all talked about what you're talking about. You get into routine situations, you get complacent. It's part of the game. But there was 9 officers that I could not make talk about complacency, no matter which way I talked about it. They just, no, I stay focused. And you know what they had in common? Every one of them had either been shot or their partner had been shot. And if you want to talk to somebody who is no longer complacent, talk to somebody who's had something really bad happen in a routine situation, and they'll tell you how to focus. They'll tell you how to deal with those routine situations, and they'll make it crystal clear in their own way as a mentor, and you know, sometimes hyper vigilant too, you know, but you're absolutely right. The complacency that can happen so easily, and we all understand it, right? It's you do it over and over again, but yeah, if you have an experience like that, it'll change how you look at those situations.
But it's also quite difficult to have the energy and the stamina, you know, to get focused all the time. But anyway,
right,
you just gotta do it.
Training, learning, training. Yeah. So I think that we can finish now. It's a very, very proud for us. Your lecture, I think that it's a very interesting topic. And I hope that in November, we can see much more topics related to performance. And so I'm glad to be here and to listen to your lecture. So thank you so much. Marcelo, you can conclude.
Yeah, I just want to thank again. It's very insightful and inspiring, and we were very, very pleased to have you, Dr. McDonald. And I'm pretty sure, as we can catch from the chat, that everybody's really liked it. And again, thank you so much.
Yeah.
Good. Good to know. It's been a privilege too. I look forward to November.
Yep. See you soon.
Bye-bye.
Okay, bye-bye.
Bye, everybody.